When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
All right, welcome back to the Elias Macko Show. Now, a new study has uncovered troubling trends in the healthcare of Quebec seniors. It reveals that many are being overprescribed medications that may not be appropriate for their needs. Concerning practice could lead to serious health risks. Let's find out more. Denise Roberts with CTV Montreal just did a piece on this subject, and she's on the line. Denise, welcome back to the program.
Hi, Elias.
Your story starts off with a story of one Quebecer, Georges Marcoux. Tell our listeners about how you started your piece and why it's so important for what we're about to discuss.
Well, there are a lot of Georges Marcoux out there. He is somebody who's kind of now devoted his life to sharing his story about being dependent on a medication that he no longer needed. And so this is kind of the start of this whole discussion about too often seniors are being prescribed a medication which may be great for a certain time to take, but often because our healthcare system is so overtaxed, there's so many things going on, there aren't people asking questions like, well, do you still need to be on this medication? And Georges Marcoux was somebody who was experiencing a lot of stress in his life, having trouble sleeping. This was 35 years ago. And his doctor prescribed him a benzodiazepine called oxazepam. And it did help him fall asleep. But he ended up taking this sleeping pill for 35 years. And
Wow.
At no point were doctors saying, are you sure you should still be on the sleeping pill? Are you know, pharmacists didn't follow up and ask. And it wasn't until he really asked himself, wait a second, I'm reading about these drugs and I'm seeing the side effects. I'm experiencing side effects such as being very groggy in the mornings. This can lead to problems with driving. This can lead to falls. And he had Alzheimer's in his family as well, and we know this can cause possible cognitive impairment. So he started asking the questions, do I need to be on these drugs? And that's when he found a sleep study that helped him, talk about what was going on, find alternative ways of dealing with his anxiety, such as cognitive behavioral therapies, and he was able to get off after 35 years of taking a sleeping pill.
Denise, is there like direct correlation? Can you make direct link? Are people making direct links between overworked doctors and the sort of let's go to a prescription as a crux?
Well, Dr. Emily McDonald, she is really a voice in the deprescribing movement in Canada. She's based at the McGill Research Institute. She's a family doctor, so she says that this overprescribing isn't happening because of any, it's really, doctors want to help their patients,
Mm-hmm.
and so they don't have a lot of time with them. And so often, especially seniors, have several things going on at once. And so they really want to help their patients get relief from whatever ailments they have. The problem is that because we don't have enough time, we're not really asking, well, wait a second, are you sure? How is this pill affecting you? How is it, are you noticing changes in your lifestyle? Are you, and those kind of deeper questions you don't often get to ask at the doctor's office. So they're working on there's something called the deprescribingnetwork.ca, and that has resources for people who want to just even learn more about the medication you're taking, because so often we're prescribed these medications, we're not reading about them. We're not reading about what the potential side effects can be, how long we should really be on these medications, because some of them really are meant as a short-term solution, not a long-term solution.
We're with Denise Roberts from CTV Montreal. She just did a piece about the overprescription of medications for seniors in this province. There are certain ones. Can you tell our listeners maybe the areas, the types of medications that are being most overprescribed?
So there's three areas, and the first one is gabapentinoids, and actually gabapentinoid is an anti-seizure medication. However, they have found it has some off-label uses that can be, so for example, it can even be used to treat hot flashes. So these drugs are possibly being inappropriately prescribed. Things to deal with acid reflux, proton pump inhibitors, that's another area, and then the antipsychotic medications, which are your medications used to treat mood and sleep disorders. So, as on their own, they may be absolutely fine. It's just you have to determine if you're taking several of these medications whether you really need to be taking them all. Is there an alternative therapy that you can access, like such as even, like I talked about cognitive behavioral therapy, but also there's physiotherapy, like just other non-medicated treatments. But too often we just don't have the time and the resources to discuss these things. And
I'm getting text messages from listeners, Denise, in complete agreement with what you've been talking about here, saying this is so true. I see as obviously someone who works in a CHSLD or gets to go to a CHSLD for their work, and they say they keep seeing over-medicated seniors in CHSLDs. What's your advice, Denise, for someone listening here? Maybe they're a senior, maybe they've got lots of medications. What should they be doing in order to make sure that what they're on, maybe 3 or 4 or 10 years later is still appropriate?
Yeah, so I think it's just like what George did. Just start asking questions, and you can go to the deprescribingnetwork.ca that has information on every medication that is prescribed, and then it's not an overnight process. So getting off a medication you've been on long term, this is not something you should just do cold turkey. You really need to be working in conjunction with a medical professional on this. And there are ways to taper off these medications safely, with fewer side effects long term. So that's one way, is just getting informed. And you can also talk to your pharmacist about this. This is and Quebec has actually now put also an emphasis on regulating doctors, looking at doctors who may be overprescribing benzodiazepines and opioids, for example. They're working in conjunction with RAMQ on that to just determine, and just make aware this situation. But also pharmacists are now being given more powers, so they can also look, next time you go get that prescription filled, you can also talk to your pharmacist about it and say, like, is this meant to be long term? Is this something that could interact with another drug? This is something people in the medical profession really care about, but it's just often the questions aren't asked and there's no time.
Denise, listen, we'll leave it there. I want to direct everyone who's listening to us to the CTV Montreal website. The headline of your story, Study Finds Too Many Quebec Seniors Being Overprescribed Inappropriate Medications. Do go check out the CTV Montreal website. You'll get the link, by the way, that Denise mentioned there on the Deprescribing Network in that story, and you'll also get to see the piece and see the story of Georges Marcoux. Denise, thank you so much for your time.
You're very welcome.
CTV Montreal's Denise Roberts.